Good morning. Welcome to the morning edition of Magna Office Hours for September the 19th, 2017. It's amazing how quick this month is going. The times are flying by. I look out the window here and it's going to rain today, so it's just one of those types of situations that we have to deal with as fall approaches and we get into the wintertime cycle. But I'm glad you're here with me today. I want to welcome you to the Magna Office Hours. This is a place where you have any questions, a TV program, you have any questions about PEMF therapy, how PEMF therapy interacts and works with other modalities, that type of thing, questions about machines, different power strengths, whatever you may have when it comes to PEMF therapy and MagnaWave, I'm happy to answer those questions that you may have at this point in time. Just some office things to deal with here. There's been several questions. We had a webinar last Thursday afternoon with Dr. Gary Nye, an integrative practitioner, veterinarian from Missouri, Springfield, Missouri, and we had a great webinar, a lot of good questions. The issue was we had a technical glitch and the replay is not available. The webinar host is working to secure that replay for us so we can put it up on Facebook and everybody can enjoy that. If for some reason they're unable to secure that replay, we will redo the program with Dr. Nye. He wants to do more programs and we'll deal with more questions, specific treatments, issues that he's had, and how he's integrated MagnaWave and PEMF therapy into his integrative practice. Good morning, folks. Good morning, Shelley. Tony's with us. Catherine, thank you for being with us this morning. I've had a few questions that have been posed to me that I would like to go over with you, and then if you have any questions, please feel free to ask them. And to those of you who are watching at this point right now, MagnaWave practitioners, if you'd be so kind, I thought about this morning, perhaps the question that you've been asked the most from the folks, from your customers or potential customers, if you would maybe share those questions would give me an opportunity to answer some of those questions for the other folks who are viewing who may not be MagnaWave customers at this point in time, but they really may not know the questions that they want to ask or they have some thoughts, and so that you can help that along. So if you have some questions that you've been asked a lot, please put those up. And we'll be happy to answer those as well. Mandy's with us, listening on her way to an appointment, and gosh, a lot of activity this morning, so we're excited about that. Let me go into a question that I've received, and recently it was, can PEMF therapy help with pain and scarring caused by the shingles virus without helping the virus to wake up, causing a potential outbreak? Well, that's a great question. That was asked, and typically if shingles is in remission and you still have scarring and itching and things like that, if it's itching, it's still going. I can tell you that from firsthand experience with some of our close people here in the office who were experiencing a shingles outbreak, the device was very effective to help relieve the pain, to make it more bearable, to help the blood oxygenation in the body to potentially reduce the inflammation as it causing irritation and pain as we go along. The shingles, it's a virus. So a virus has to run its course. Can we make you more comfortable during that course? Yes. Is it going to reverse? Not necessarily. Can it help with the medications that you're receiving to better see that they're assimilated and metabolized by the body? Yes. Is it likely to cause an additional flare-up? That's not what we have experienced in the past. So shingles is not a comfortable situation, but it is something that you need to deal with. And can the oxygenation help with the pain and the scarring? Absolutely. It certainly should be able to help in that regard. So let's see if we've got any questions that have come in. Not at this point, just a lot of folks saying hello and being here. We appreciate that. Another question had to deal with, I received yesterday, had to deal with herniated discs, guidelines and expectations. Well, certainly herniated discs are not comfortable, can cause a lot of discomfort and a lot of pain. This particular person was talking about issues right in their neck area here that is causing some problems, and they've noticed and been diagnosed that they have a herniated disc issued. So what they were doing is taking the butterfly and trying to be very concentrate on it and lean back against it to treat the area, and it almost felt like they were working so hard to keep the butterfly in place that it wasn't helping what was going on. And so I suggested that they basically take the large loop, rest it on the back of your skull here, down into your back area, and just comfortably lean back and treat the area of the neck and the upper shoulders here with the large loop, and to help gain some relief. What she was getting is that she would treat herself at night. She would feel much better. She would go to bed, sleep. Well, we all know that sometimes we sleep, the pillows, how we lay, what goes on, that you can be sore just from that sometimes, or a little stiff in the morning when you wake up just from that whole process. Then she would go through the day and not treat herself till the next evening. So my suggestion was, again, use the large loop this way to where you come around and it's on your shoulders, or put the large loop over the head with part of it on your back and lean up, and part right here on your chest, and treat in this direction up and down. So you're treating the spine, you're treating the shoulder area. You have to remember that, yes, the discs are painful. When my wife had a herniated disc situation, it was a situation to where it was in her disc, certainly, but she couldn't raise her arm above here and was in pain all the time in her shoulder in this area. So yes, it's the disc, but it certainly refers and spreads to other areas. So you got to treat everything that could be responsive to that particular indication that you're dealing with. The other thing that became very important and very critical in this conversation that I had was that you need to treat as often as you can. When you have something like this, you need to get, as we often describe, you need to get ahead of the issue. If you've got inflammation, assuming that this is a nerve that's inflamed, we want to get it back to where it's in its normal state. Well, that can take some time. It may be here, and after several applications, you get it down to here, but it's still inflamed. After several more applications, you may get it down to where you want the nerve to be, and that can take a lot of applications. Well, if you've got an issue that you're here and you treat and it gets down to here, and then you go throughout the day and it's back again, you're not getting ahead of it. So what I recommend, and what I recommended here, is to treat in the morning and the evening, or even 3 times a day. Now, if you have a machine, that's an easy thing to do. If it's somebody that's a customer, that's not so easy for them to be available 3 times a day, or you to be available to them 3 times a day. But certainly, if you can treat a couple of times in a day, every day, to get ahead. We want to get ahead of the problem, so as it begins to rebuild, we're still ahead of it. We don't want to be fighting it every day. It's kind of like we talk about a spur, a bone spur that someone may have on their foot. Yes, we can relieve the inflammation and relieve some of the pain, but that spur is still going to be there. As soon as we quit and they start walking, that's going to continue to exacerbate the problem. So in this case, I suggested 2 times a day or even 3 times a day. And for a customer, it may be a situation that you treat them twice a day. Now, here's the thing. It doesn't do you a lot of good to treat them at 9 o'clock in the morning and then at 10 o'clock. But if you can treat them at 9 o'clock and then 2 o'clock, where you have 4 or 5 hours difference in between, you're catching up with it and trying to pull it down. If you could do it at 9 o'clock and 5 o'clock, would be ideal, or 9 o'clock, 5 o'clock, and 10 o'clock. So that's a type situation that you need to deal with there. So you need to treat as often as necessary to get ahead of the indication or the situation. And then you're going to get to where you have a plateau. Some of you have heard my story when I talked about my wife, which is how we got into this business, with her 3 herniated discs and unable to raise her elbow or her arm above here. We treated her every day for 30 days. The first few days was twice a day, but then we treated her every day for 15 or 20 minutes, every day for 30 days, and then we stopped. And now, in the beginning, we'd treat her 1 or 2 days and stop, and she'd be good for a couple of days, and then it'd start to come back. So that's where we went into the routine of let's go 30 days and stop and see what happens. We did that, and we got 2 weeks worth of relief. We did another 30 days every other day this time, and we stopped, and she got 4 weeks worth of relief. We repeated that situation, and she still got only 4 weeks worth of relief. Only. In most cases, that's excellent. And for the last 12 years, that's what she's gotten. So every 3 to 4 weeks, depending on her activity with the grandkids and everything like that going on, she gets a couple of treatments, and then she's good again for that period of time, because we've gotten ahead of it to the point that it takes 30 days or so, 3 to 4 to 5 weeks for that inflammation because of the herniation to begin to creep into where she becomes uncomfortable and it begins to affect other things. So everything is not a 2-treatment, 2-session deal and it's over. Unfortunately, we wish everything was, because that would be great. We'd be doing a lot of 2-session treatments and everybody be happy and everybody be successful, but that's not how it goes. So it takes dedicated time to get ahead of these situations. And so that was the answer for herniated disc. Some things are going to take more time. If it's muscular, just tissue, soft muscle tissue, it's not going to take as much time and we can be much quicker in achieving the results that we're looking for. Let's see now. I got to make sure I'm ahead with my notes. Let's see. I thought I saw a question in there. Do you recommend the mat or loops for the shingles sessions? Well, I don't think, Shelley, I don't think it makes a lot of difference. If the shingles are on the side, you might want to take the mat and wrap it around to where you're getting a large area of your body so you can get good oxygenation in a much larger area than the area that you're dealing with. So you want to certainly reach out beyond the area that you're dealing with at this point. And to better, let me turn my phone off here. That would work very well if I did that. So we're not bothered with the phone ringing during the sessions. Why won't it go off? There you go. Phone's off. Everything's directed to where it needs to go. But I would, the mat would be fine, or you could take the loop, depending on where the issue is. If the loop will encompass the whole area, then certainly you could use the loop. But they're both putting out the same type of signal to the area, so either one can probably work just fine. The case that we had, we were traveling, the person we were with who was suffering from this condition, we went in and all we had was the loop with us. We were traveling, we had the butterfly and the large loop, and that's all we had, and it worked very effectively for that indication. Good morning, Pilar, Samantha, thanks for being with us. Charlie, we appreciate you being here with us today. As I said a little earlier, for those of you who are practitioners, Magna practitioners, if you would kind of maybe post up there the question that you've been asked the most. What do most of your customers want to know? Someone asked the question, one of the practitioners on the Magna Wave Minutes said, would you please describe what PEMF is and what can be expected? And I addressed that yesterday in a Magna Wave Minute. If you'd like to see it, it's on the Magna Wave Facebook page. It's facebook.com/MagnaWave, and it'll take you there. And the Magna Wave Minute is there, specifically talking about what is PEMF and how does it work. And I covered all of that in that yesterday. Certainly take a look at it, and I think you can gain something from it. A question that is often brought up is the strength of the various machines and the expected results. Excellent question. The basic thing is, regardless of the strength of the device, the Magna Wave device, the high voltage PEMF devices, they're all putting out the same kind of signal. They're putting out the magnetic field. This kind of goes to what I was talking yesterday, and I'm going to do a Magna Wave Minute on this. And so for those of you that are here, I'm going to kind of address it now. The people talk in terms of Gauss. How many Gauss are you delivering? What is the Tesla strength of the machine? And you'll see companies that are saying 4 times stronger or 2 times stronger than this machine and that machine. Here's the bottom line. The Max machine is the most powerful machine we have. How often does anybody turn that machine up to 100% of its power? Maybe 10% of the time. If they're treating a knee, perhaps, or an elbow, or a horse's foot, or a horse's knee, you'll turn it up higher, and in many cases, probably never to 100%. So it's not the amount of Gauss. Yes, it's important that you have a machine that will deliver the ample strength that you're looking for. But what it's about is the exchange of energy, and it's about how much energy you can put into that area comfortably to be able to achieve the results that you're looking for. The whole deal about our devices is the speed of return. the rate of return for what you're approaching. You can use low power devices for long periods of time to achieve very good results, but it takes a longer period of time. I'm not knocking those devices, but it just does. You'll look at treatment times of a half hour to an hour a day for 3 weeks, and you get a result that you're looking for. Our devices will give you that result much quicker, so then you can get about the process of healing, which may take lower settings, or you might do it lower so it's more comfortable, and you can do it for longer periods of time. But you, again, like we talked earlier, you want to be ahead of where you're going with those types of situations. So yes, Gauss is important. You need a machine that delivers ample amount of Gauss. But what it really comes down to is energy that is relayed comfortably to the client. And with our devices, if you talk about the semi with the low, medium, and high setting, when you're up on high, if you're treating something like perhaps what we're talking about here, you might treat the herniated discs on the medium or the high setting all the time. Will it work? Sure. You might go 20, 30 minutes instead of 10 minutes. But you still may only have to do it every other day once you get going, or once every 3 weeks once you get going. So the power is good. I always say if someone is if you're treating massive athletes, horses, football athletes, or professional basketball players, or an individual who is very active as an athlete, the stronger machines will give them the result they're looking for more rapidly, and they may feel more comfortable with those devices. But the semi device will certainly provide that relief as well. It's just going to take a little longer, not exceptionally longer, but a little longer. And to that, for the horse people, when we talk about the semi device, will it treat a horse or will it treat a person? Absolutely. And as a normal treatment, it's going to be normal. It's going to be, if you're going to treat that shoulder for 10 minutes, you're going to treat it for 10 minutes regardless of what you're doing or which machine you're using, because you're not going to turn it up all the way anyway. But when you get into more specific indications where you want a more rapid response, then the stronger machines are certainly there to do that. So I hope that clarifies that, and I will approach that in a Magna Wave Minute as well, or perhaps cut this out and share it in a Magna Wave Minute as we go on. Let's see if there was another question here. And if that's not clear, if I need to explain that further, please, someone ask the question. What kind of waves does the machine use? Was asked this a few weeks ago. Well, what the machine uses is it's a wave that goes up to more of a sharp point and then has a rapid decline. Now, the secret, what Dr. Dennis worked out or found out in the NASA study to achieve optimum results, is the rate to which the wave drops off. So you don't want a wave that goes up and comes down like a slope, like a mountain. You want a wave that comes up with a very rapid decline, a very rapid slew rate as it goes. That's where the effects are received when we start talking about treatment. Now, can that be achieved with a square wave that goes up and drops straight down, or a wave that goes up like our digital machines have more of a little blunt top on the waves? It goes up, it's a little blunt, and it comes down, which means that the digital machines are a little softer. You don't feel the intensity as much with the digital machine as you do with the analog machine like the Max or the Pulse Pro. So in essence, you can take the digital machine a little higher because it's more comfortable. So you're able to put a little more energy in with the digital machine because it's more soft in its approach. But the wave that we use is a wave that, two things. The wave goes up with a very rapid slew rate, and it stops. And then it fires again, goes up, rapid slew rate, and it stops. So each burst of energy is an individual burst of energy. It's not a wave that continues, slopes down, and that's called a sine wave, where it goes like this. Sine waves work fine. You can go back to all the studies, and people have said, well, our wave does this, and our wave does that, and we've got a patented wave that does this. And when you get down to it, and you go back to all the studies that have been done years ago, all the waves work. It's a matter of time that you're utilizing the waves. Are you using them? Is it a strength of the machine and the wave that's being used for an hour a day, every day, or 2 times a day for an hour a day? Or is it something that you can use a wave that you can do it in 8 to 10 minutes on a particular indication? Or you can treat the whole body in 20 minutes and do it only once a week and maintain that for the time. So that's the primary differences, and that's the way what we use and what Dr. Dennis has found, it's the slew rate of the wave, the drop off of the wave is where the benefit really occurs. And then the higher voltage machines are able to stop that. So your exchange of energy is very distinct. Energy in, stop. Energy in, stop. Let the body absorb it, get used, let it get, move with it like that, and that's where it comes from. Very good question, Mandy, on the type of waves that are used. Also on the Facebook page, if you go into Magna Wave and search in the little box on there, I believe it's upper left hand corner, waveform. I did do a video, a Magna Wave Minute, I believe, some months ago, where I showed the waves, a drawing, and how the waves are approached in that fashion. Very good, thank you. Any other questions that you received? Let's see. Jennifer asked, is it safe to treat the lower back and the hips on someone with a pacemaker? You have a SIMI. Well, I think you'll look in the SIMI instructions. It talks about pacemakers and those types of devices. They're talking about needing to be a foot or so away from the device. As a rule, in the past, when we're talking about the high power machines with those types of instruments that we've said, perhaps you should stay away from them. There are doctors who have said on particular pacemakers, now the pacemaker and the defibrillator game and all these things have changed a lot over the years in the devices and how they're powered and how they operate because of all the electronics that were around today in the homes with the microwaves and the computers and all these kind of things that are emitting power and so forth. So with some of the digital devices, it's been reported and okayed as long as you're a foot or so away. So if you're treating the hips and low back, you're a foot away, and you're not treating right over the device. So I would check with the doctor to determine the age of the device and do they recommend that this is used. Some devices can go through TSA checkpoints. Other devices you have to have a card to whether they let you go around so you don't go through those devices. Well, that whole thing has changed. I wear hearing aids. I was a musician in an earlier part of my life and lost some hearing thanks to my bass player in my left ear. So I wear hearing aids and they don't cause me any problem. The device doesn't cause any problem when I wear my hearing aids as far as my battery life or anything like that. So that has changed. I hope that's clarification. You certainly want to make sure that you're operating within the directives of your client and your patients or your client's doctor with regard to how that works. But it's eased up somewhat in those areas. There have been docs that have said, yes, you can do this with my pacemaker or the pacemaker that's put in. Great question. Does the SIMI and MAX have the same type of waves, Krista? Yes, that is correct. The SIMI and the MAX produce the same type of wave. The difference, as I talked about earlier, was the strength of the delivery. And if you're talking about putting a coil on someone's upper back on the SIMI and turning it on medium or high, the treatment time is 10 minutes. And you might go on that particular person 20 minutes. You might go 15 minutes. Whereas with the MAX, you might be able to put it on, turn it up to where the way we do the MAX or even the Maya is you turn up the machine and I'll ask the person, how does it feel? It's fine. Is it comfortable? Yeah, it's comfortable. And then I'll click it again and I say, is it comfortable? Well, it was more comfortable before. Then fine. We go back to the more comfortable setting. Does that allow us to put a little more energy in the area than is delivered from the SIMI? Yes. And it can potentially aid for a little quicker response from that person, but the waveforms are the same. So that was a great question, Krista, and I thank you very much for presenting that. If you have any other questions, folks, please put them up there and I'd be happy to answer. That's the 2 or 3 questions that I received in the last couple of days that I wanted to certainly go over with you this morning in this office hours. And this is not necessarily limited to machines and how they work and waveforms and so forth. If you have a question about what MagnaWave can do for you as a personal practitioner or a practitioner that wants to utilize this in their practice as a veterinarian or an individual practitioner or a chiropractor, whatever it may be, certainly we want to talk about those questions with regard to company support, training, marketing, whatever that may be. We've been going now for about 30 minutes, and I enjoy being able to bring you this information. you'll see, there's a lot of information that's presented, and people will talk about we have the cutting edge technology, or they have the cutting edge technology, and we're digital and they're not digital, and digital is digital, and we have some digital machines. Why digital? Why does somebody want that if that's what they're discussing? Basically, the digital machines are more controllable. I mean, our machines are an analog machines. You can certainly turn them up and turn down, so they're extremely controllable. But when you talk about dealing in certain situations, potentially with doctors or with the FDA, with various regulatory boards, they want you to be able to say, I treat on a 4. For example, I have a young man, it's a football player here in the area, down in the Danville area at Center College here in Kentucky, and he's got a ruptured disc. And so he wants that to be treated. And so I talked with Dr. Jerry Dreesen, a chiropractor that we work closely with in Washington, and determined what we felt was the best procedure for approaching a ruptured disc. And we determined that let's come at it at a low setting for a series of sessions to let it just gradually work its way to comfort, and then begin to accelerate it so we can hopefully bring things back in the parameters that the doctors want. Well, so I'm treating this young man on the Maya machine. And so he's now in his 4th or 5th session, and we treated him started at a 2. And so we knew it was a 2. He knew it was a 2. Moved it up to a 3. So he was still comfortable with the situation and the sessions. Yesterday, now after I believe it's the 4th or 5th session, moved it up to a 4. So in the digital machines, you have that kind of control that you know exactly where you're going and exactly the energy that's being delivered to this person. So they can keep proper notes. They can talk with their doctor or their trainer, the people that they're working with, and know where it's at. The FDA likes that type of control on a machine that's going to be applying for FDA approval. So that's why the digital gives us that opportunity to do that, and it's totally controllable. Now, you can mark the digital machines if you want and turn it to there and say, this is my 3 or this is whatever. The challenge there is the digital machines have electrodes that closer together, the spark going between them is very quick and low. Further apart, the spark that goes between them is more powerful, kind of like a lightning bolt. Lightning bolt strikes away from you and you see it, and then all of a sudden, a few seconds later, you hear the thunder. When the lightning bolt hits across the street, like this, bingo, you hear it right this second, you hear the thunder right this second. Now, these electrodes can wear. Over time, they'll wear down to where they maybe can't get quite close enough together to really reach the low setting that you might be looking for in some situations. Digital machine won't have that issue. The digital machine's all computer and chip and all that stuff, so every time it fires exactly where you've got that dial set, and it works that way. The other machines, if these wear out a little bit, you may not be able to get the low that you're looking for. No problem getting the high. Although you could get a high that's it and you can't turn it down anymore at all, and so now you're stuck in that area until you have the machine serviced. How often does that happen? After hundreds of hours. I've had people that use their machines every day on high settings, whether they're treating athletes being humans, or people that are in that knees and ankles, or treating horses' feet, legs, and ankles, that they turn the machine way up. In 400-600 hours, those spark chambers will wear out. But we have machines in the marketplace 10, 12 years, thousands of hours that have never been. They use them more moderately, they're comfortable, and they'll last a long time the way they're set up to work like that. But that's the primary difference, is the spark chamber on the analog machines can wear out. The digital machines should work conceivably forever. The other benefit to the digital machine, and we don't know where that's going to go, but they're programmed, they could be reprogrammed. If somebody came up with something and found, hey, this waveform will really address these indications or these situations, they could be reprogrammed to meet those specifications. So in the digital world, you can very well see devices. Currently, this hasn't happened in many places, at very little at all, where someone has said this specific waveform at this here and this there will do it. There's a lot of people that talk about setting their machines differently, but the studies aren't there and so forth to support that. But that could happen, and digital machines can be programmed. So that's kind of a benefit down the road as things go. My goodness, here's a question. Looks like there's a couple of questions here. So let me, when someone asks what PEMF does, what's your best succinct answer? I'm assuming we have to be compliant in how we explain this, i.e. not making cure claims and such. What does, okay, PEMF, what does the, someone asked what PEMF does, what is the most succinct answer? I'm sorry, I had to read it twice in small print. What PEMF does is basically improve cellular health. And again, this is on a Magna Wave Minute on the Magna Wave Facebook page that I posted yesterday. But it makes cells healthier. Good, healthy cells are what the body wants to fight any situation that's going on in the body. Any disease, any infection, any virus, it needs good, healthy cells to do that. Cells become unhealthy, they lose their potential, they lose their electrical potential, and what this does by making the cell membrane more permeable, allowing oxygen in, working with the cells at the molecular level, at what they call the mitochondrial level, we can help the cellular health improve. If we have an army of healthy cells, that's much better than an army that's tired, malnourished, and doesn't have the equipment it needs to perform. And so that's what the machine does. The machine improves by oxygenation, allowing the body to better oxygenate the cells to better facilitates the body's healing capabilities. What we do is basically supply energy supplementation to the body for cellular health, allowing the body to better heal itself. So I might write that down. There's an elevator speech for you. Energy supplementation to allow for better cellular health so the body can better heal itself and accept the nutrients that are available to it for the healing process. So I hope that helps as far as a succinct explanation. Someone may ask for more than that, and we can get very technical, but that's the bottom line. Oxygenation, reduce inflammation, relieve pain, allow the body to heal better. It doesn't get any simpler than that, and it's not rocket science. Dr. Dennis, when he talks about it, kind of makes it rocket science sometimes because he's so deep in his explanation. But that's what he says, and that's what it does, and that's what other people have found. Now let's go to number 2. Do you see a trend towards digital for horses using the Maya, or is that niche using the Max exclusively? No, I see a trend. Here's the trend. For 15 years, the Max is all we've had for everything. And so the people in the horse world using high-powered machines use the Max. And they understand the Max. They understand the difference in how the signal's addressed and how it feels going in and what it does in their mind. You know, perception of how they use it is the key. So what we have is people that, as I say it, grew up on the Max, understand the Max, will use the Max. And that's what's currently happening. Are we seeing, and I'll say it this way, if somebody comes into the system with a Maya or the Semi, and that's how they learn, and that's how they grow what they're doing, they don't really understand the Max. And so it's got 15 years of Max, a year and a half, almost 2 years now of the Semi, and the Maya. So it's gonna take time. I'm gonna have to say that people understand everything they're getting today: self-driving cars, artificial intelligence, all this type of stuff. We're a digital world. Pick up your cell phone and use it for money phone for your business or whatever else you're going to do. And we're in a digital world, and so people understand digital and they want digital. So I think that I don't think the Max is ever going to go away. It's a heavier device. Most of those types of devices today that are in that category have turned into pretty heavy devices because of where you can get parts and how that all comes together. Heavier in the concept that the Max is more like 60 pounds and the Maya is more like 35 pounds. So there's a significant difference in that. But as I've told people, well, I put it in and I take it to my barn and I use it, or I take it out of my car and I'm at a barn all day long. So that extra weight's not an issue. So I like the Max, but I don't want to bounce around here too much. But I see the digital flow improving. And people want kind of like that, being able to set it over here and knowing that it's not a maintenance issue that they're going to have with these devices. So I think over time that will change. But right now, as I said, 15 years of one, it's very difficult for someone to understand that I want to use something else. Although I do have practitioners that have the Semi, the Maya, and the Max, and they integrate them into their practice in various ways, very successfully. So they all are doing the same thing. Don't be afraid that the Semi won't help your horse, or the Mac or the Maya won't help your horse, or the Max won't help your horse or your dog or your person that you're dealing with. There are different parameters in how fast they work and how you would approach specific treatment patterns, but that's the difference in the situations. Great question, Kristen. I hope I got it. And so that's kind of how that plays out. When we first started, when the Semi first came out, and I compared it to the Max, I personally felt I don't understand this. Of course, all I've ever used is the Max, treated thousands and thousands of people, horses and pets. I just didn't understand. I just don't see how this is going to work. But then when I used it on myself, and I saw that, well, if I use it, I use it for 20 or 30 minutes, my shoulder feels okay. When I had my initial prostate scare last year and I needed to treat myself every day and use other complementary methods, I used the Semi exclusively. And my diagnosis and report was very positive, dead, benign, not an issue, keep up the good work. And so they all work, and they all do it, but they all do it a little differently, and so it's where you're comfortable. All right, let's see if we have another, Peaches. Kadria is with us. Good morning, Pat. I'm interested in research and practical applications for Magna wave and Lyme disease. Kadria, Peaches. That's how I met Kadria. I was at Dr. Marty's office, and when they introduced me to her, I'm Peaches. And so when I see her name, I think Peaches. But at any rate, Lyme disease. I don't know at this point if there's a lot of succinct research with regard to Lyme disease. Most everything we have at this point is pretty well anecdotal. We would love to, the amount of research that we could do and studies that we could participate in, we're getting to a position that maybe we can do some of that, even smaller studies, where we could say, look, let's get 10 or 15 people, let's get them in here, let's do this kind of thing, and let's present this result, and then let some peer people review it and go from there, are certainly within reach today that were not within reach a couple of years ago. But I don't see a lot of specific research on Lyme. But I do see from the anecdotal situation, what people do is they'll treat systemically, they'll treat the whole body, and then they'll treat wherever the Lyme disease is kind of focused. And I can tell you that from my perspective, the number of people over the last 10 years who have purchased Max machines specifically for Lyme disease and have received the results that they were looking for or made the situation easier for them is amazing. The number of people that have done that and used the device in one way. The first one was a chiropractor, equine human chiropractor who had Lyme disease. And in fact, I had been trying to talk to this person for years to maybe integrate this into their practice. Not until she found herself in a situation, somebody had a machine, she put it on her lower chest area, treated herself for 30 minutes, and to hear the discussion, it was gone. It changed the situation overnight. And then repeated treatments certainly kept everything in place. But I will certainly research that a little more and see if there's anything out there. One thing you can do now, again, you can put Lyme disease and PEMF into Google, and you're going to see a lot of stuff that comes up from people that are saying that if you use their devices, and that's true. I mean, I'm telling you that we've seen wonderful results, but specifically studies, I would put Lyme disease studies / PEMF. I was looking yesterday, someone had asked the question specifically it was dealing with, what was it? Let's see here. I probably still have it here on my computer if I can get it over there. Talking about PEMF, that's what it was. Using lasers or PEMF for stem cells. And the NASA study and various studies have shown that PEMF will stimulate and enhance stem cells. And so if you're approaching where they're using stem cell injections today to help areas of the body that are deficient in growth, cartilage, tendon, whatever the situation may be, for these stem cells to enhance that overall situation. And this person saying, well, the doctor says the laser will do that and it's shown to do that. And that's true. There are some studies and there are some things out there where they've used lasers effectively to stimulate stem cells. And the same thing has happened with PEMF. Which is better? Well, whatever the doc feels is better. And because docs and people, individuals land on specific things. My situation to that is I think that our method of delivery of PEMF is very complementary to other modalities. So if someone's wanting to use a laser and they're wanting to use PEMF to deal with stem cells, lasers don't necessarily penetrate bone very well. They can enhance the area around the bone. Magna wave PEMF or PEMF in general will pass straight through the bone. And when you get into other situations, cartilage situations, where you want to get the greatest impact, I think complementary medicine, or as Dr. Gary and I would say, or many people today, integrative technology, integrative use of modalities to better enhance what we're doing. Like Dr. Marty always says, I use integrative products, integrative modalities, so I can get a better result with conventional medicine. And so it all spins together, and that's how it plays. So, Kadria, I will look a little further. Thanks for great question. I appreciate the question, and I hope that helped a little bit. Another one: are there any suggested treatment protocols for anyone? Oh, are there any suggested treatment protocols anyone is using? Well, I kind of covered that. The protocol being treat the area of discomfort, and then treat systemically. The reason we want to treat systemically, treat the whole body, is because we want to have the body's total blood supply nourished, ready to go, ready to fight what's going on. I showed it yesterday in the thing. Maybe I can pull that up here. Let me see if I can pull that video up here. And I want to make it so you can hear me when the video is playing. Okay, so let me put this. Now, I'm with you on this particular video, so you can still hear me. So I'm going to start this. And what you're going to see as it starts is the blood. You can see there, let me stop that. You can see how the blood cells are clumped together. They're not flowing freely through the body. This is pre-PEMF. So I want to continue to show this video here a little bit for you. And you can see, oh, not that one. But there, that's pretty good. You can see how clumped up they are. In many cases, that's called rouleau. I always describe it as a roll of quarters, to where you can only get oxygen to specific areas of those blood cells. You can't get it everywhere, so it's continued to flow. And let me open them up here, and you can see that they're just not doing much. And they're all jumbled up together. It's called rouleau. And so now what's going to happen, let me come down here a little bit. We're going to see here, on the other hand, is post-PEMF, is you have the blood cells looking very smooth. They're not stuck together. They're ready to go. And look at the size of the white blood cell in the left-hand portion of the screen there. That's a white blood cell that's ready to do its job. And that's what we want when I talk about the army of what's going on. So now we'll see how things are moving, and it's just flowing very smoothly as we look at how, this is just after one 15-minute treatment with PEMF, treating the lower back on a lady to receive. There's another large white blood cell over on the thing, but that's the way we want the blood to look. We don't want the blood to look like this. We want it to look like this. And Magna wave and PEMF isn't causing this. Magna wave is allowing the body to better work with itself, to improve its oxygenation, to produce better blood flow. Again, as I said earlier, that army. I want a good, strong army of blood cells to help me. So let me come back here. My screen's a little jumbled up here. Figure out where I am. There we go. Hello. How you doing? So, great question. We want to treat systemically, so everything that goes to where that's centered. Rheumatoid arthritis is quite the same way. I had a nurse in the office last week that we were talking, and she was treating someone with RA. And so what she does is she goes to the area, then she treats the shoulders and head, because it's neurological a lot of times, and how it's transmitted and where it's going and where the effects are. Why does it work down here today, then over here tomorrow, and in your hips the next day? Well, let's treat the area that a lot of this comes from, out of the brain. Let's treat that, and then let's treat the specific area. So, Kadria, I hope that helps. Are there specific guidelines? There are some directions that you can follow and pursue in these areas. And I think it's very beneficial. And all we can do, we don't treat any condition. So we don't really treat Lyme disease. We really go out and work with the body as far as energy supplementation to allow the body to better heal itself. And for those of you who watch regularly and talk with me, you'll hear a lot of the same thing repeated, but that's really what we're doing. So the protocol, Kadria, or the guideline, is to treat the body, improve the overall cellular health of the army, and then let the body go after what you're trying to deal with, or the indication that your particular customer or client is dealing with. Okay. Any other questions? I'm more than happy to answer them. Thank you so much for the questions that were presented today. I think it's an excellent way to learn and grow in what we're doing. I think, people have asked me a million times, well, how come this isn't used more and more? Well, it's used more and more all the time. You just don't know it. There's a new glioblastoma. It's a horrible form of brain cancer with tumors. But there's a new device that they're seeing very good results with. It's like a little cap that they put on that's PEMF. Now, they don't call it PEMF because when they got their FDA clearance, they gave it a little name and they operate it this way. But when you get into their research, it's PEMF. It's pulsed electromagnetic signals, as they'll call it, or pulsed energy. And so they'll do it many different ways. But they're using it for autism. They're using it for TMJ. They're using it for depression. All FDA-approved types of applications of PEMF. So it's coming, but it's not described that way. It's described as for the brain and that type of stuff. They call it TMS. And the glioblastoma has a particular name of the device, and this is what it does. And so it's growing in momentum. But does everybody call it PEMF, or does everybody call it pulse magnetics, or does it's just, but when Nikola Tesla discovered that he could create a magnetic field by putting these coils together and get a result, when he projected that field into water, into plants, into people, and start seeing promising results, the whole thing began to change, and it's taken a long time. It's different in Europe. PEMF therapy and our types of devices are very recognized in Europe. Lasers came from Germany and Europe and different places. What we're doing today with Dr. Pappas, who really started this years ago, didn't quite do it the way it should have been done, but with how devices were brought in, they've been used in Europe and other countries for years. It's the United States that's a little different because of our regulatory issues and how they approach various and sundry modalities and how things are used. So it's used extensively in other countries. You leave the country and you go to Tijuana or various places, and there are clinics set up around the world who use our therapy and other integrative therapies for cancer. And they've been doing it for years. And so, we don't heal anything. We don't talk about what we can do or what we can't do. But if you go research, which you can do on Google, you can see what's happening a lot in other places around the world. And that's how we learn. And we all would like to, they talk with drugs. So you always hear, well, why can't they go ahead and approve this drug instead of waiting 15 years for this drug that can work well against cancer or this disease or that disease? Why do we have to go through that long process? That's just the way we do it in the United States and the way it's been established. Would people like to see that change? Potentially, so you can get these powerful drugs tested more readily so people can make their decision as to what they want to try and do on their own. Today, if people want to do that, they have to, in many cases, leave the country to try various and sundry things. And there's a whole medical tourism is what they call it, to where you can go to a particular country and get your bone work done, or your teeth taken care of, or your eye surgeries, or back surgeries, or various indication treatments for tumors and whatnot. Medical tourism is a huge industry around the world. In fact, I've been talking with some folks from Belize, where they're trying to set up a whole medical tourism situation in Belize for many integrative processes to be used and utilized in that type of facility that they're working on. So I hope that helps. Great questions. Always like to share the information that I've garnered over the years, and if I don't have the information, my method is, and my whole basis of our business, if we don't know, we're going to ask and find out and get you the information that you'd like to have to help along with these indications, questions, and thoughts that you may have. So it's about 10 minutes till 10. I've got another meeting at 10 o'clock that I need to be at. So again, I thank you so much for the questions that you've asked today. I look forward to being back with you this afternoon at 2 o'clock. So if you have some additional questions, email me. I'd be happy to answer them. I may cover some of these again, and I certainly I look for new questions and new thoughts at the 2 o'clock session of Magna Wave office hours this afternoon. So thanks for being here. Have a wonderful day, and look forward to visiting again.